Doctors of Reddit, what made you say? How are you still alive? Patient stabbed himself in the neck with a thermometer that pierced his trachea. Missed all the important arteries, carotids, vertebrals, just hit some minor nerves. Good guy. Patient provided his own temperature reads until they removed the thermometer. My dad's a doctor, so I asked him. When he was an intern in the ER, someone walked in the front door with a kitchen knife sticking out between his eyes to the handle. The knife went through his sinus cavity and ended with the tip in his throat, millimeters from his brain stem. He goes into surgery and walks out of the ICU the next day. My dad says he is the luckiest man he ever saw. He still got stabbed in the face though. I had a guy with a Bowie knife sticking out of his chest. The knife was pulsating. I could literally count his pulse from across the room. That's not a knife. It's a long-range heartbeat monitor. Hemoglobin of 35, 3.5. In a 35-year-old guy with a chronic rectal bleed he refused to have looked into for months because he didn't want anyone looking at his bumhole. Finally brought to the ER by ambulance when he fainted, aka started dying, in a grocery store. Guy comes in with a bit of chest pain. Tells me the big coronary artery on the front of the heart was 100% blocked. I tell him, who told you that? He says his doctor did about 10 years ago. I don't believe him since patients never ever get any of the stuff their doctor tells them right. I let the cardiac surgeon know what this guy said and he too goes haha 100%. So he's dead? If the biggest coronary artery is totally occluded and for 10 years no less, you are a dead man. Lo and behold, we get an angiogram and it was fucking 100% occluded. The artery on the back of the heart made a connection with the front of the heart to pick up the slack. It was some lucky shit. You ever have an artery so clogged that your heart said fuck it and built a new one? I used to work as a clerk in diagnostic imaging at a hospital, and we had a man come in for an X-ray complaining of chest pain. His records showed his last visit was 2 years prior when he got drunk and fell into a fish tank, breaking it. ER stitched him up and sent him home. Fast forward 2 years, and we are all gathered around the computer screen looking at an X-ray that showed a 12-inch long piece of fish tank glass sitting in his chest, with his aorta resting right on top of it. It was on an angle running from his left shoulder down towards his right hip. There were other shards of glass too, but this one was the biggest. Emergency surgery happened right away. How did someone not notice that 2 years prior? A patient I took care of had a car fall on his face. He was underneath it working when it slid off of the jack. The only reason he survived was because he broke every bone in his face. He had a LA4-3, which allowed for his brain to swell. He also needed an additional surgery to relieve the pressure of cerebral edema, but the facial fractures did allow for a great deal of give in his skull. I was rotating through ICU, so I first saw him just a day after the accident. His head was so swollen, he didn't even look human. Fast forward a few weeks later, I was rotating through a different unit in the hospital and came across the same patient. He was quickly recovering and had minimal neurodeficits. Pathologist here, had a guy who had died suddenly and unexpectedly. I soon learned he was the recipient of a lung transplant about 15 years prior. When I opened the man up, his transplanted lung was upside down. I flipped the lung into the proper position, and bloop. It flipped right back to upside down. That was quite alarming. The surgeons who originally performed the transplant incorrectly attached the organ. When he by chance entered the correct position, the lung flipped over, causing his pulmonary artery to seal shut, resulting in his death. The man lived for 15 years with a lung that was dying to flip upside down. And it was only by sheer chance he didn't move in such a way that allowed it to do so until the fateful day of his death. It is one of the most fascinating cases I have ever witnessed. Saw a guy with a machete lodged up into his skull. Asked him if he was okay, not sarcastically, just threw a generic question to check his ability to respond. He said yup. There is a man you don't want to fight. Not a doctor, but I'm a nurse and my story is good too. I had a college student come into the unit on the night of their 19th birthday. They wanted to party, but had a test the next morning. One of their friends told them that if they took one Adderall for every drink that they had, they'd be sober by the morning. They had 15 shots, and 15 20-milligram Adderall tablets. If you were wondering, no, that does not make you sober. It does, however, make you rip off all your clothes in a hallway, spit at the nurse that is trying to help you, shit all over everything, and then literally fucking die. Luckily for them, they weren't dead for good. We got them back and they spent most of their sophomore year of college in a hospital, with a hole in their neck, learning how to walk again. Not a doctor but encountered a woman that was shot blank in the head by her boyfriend. Bullet entered one of her eye sockets and exited above her and ear on the same side. She called 911 on her own and survived, was in ICU for weeks, and testified against the bastard who is now thankfully in prison. Not a doctor, but been a paramedic 15 years. Had an 8-year-old kid on a ripstick, similar to a skateboard, lose control and roll into the path of an oncoming SUV in his neighborhood. He was hit by then run over by it. We arrived to find him face down under the vehicle, unconscious, barely breathing. After all was said and done he had bilateral femur fractures, one lower leg fracture, multiple rib fractures, a blown pupil, and open skull fracture, subdural brain bleed, attention pneumo, air escaping lungs into the chest cavity will squish the lungs and heart if untreated, and when we were bagging him, breathing for him, we felt subcutaneous emphysema, free air that crackles like Rice Krispies / bubble wrap, in his hip. Yes, hip. We flew him to the children's hospital expecting him to die within the hour. He was in a coma for days and had to have multiple surgeries, but made a complete recovery, 100% neurologically intact as well, and graduates high school in the spring. His was such an amazing case the hospital made him one of their Miracle Kids of the Year. Old guy comes in with his wife. She tells me he passed out last week and I couldn't wake him up. After about 2 minutes he came around and he didn't want to go to the hospital, so we booked an appointment to see you. I'm a little concerned by this, and his heart rate is a little slow, so I send him for an EKG, heart rhythm tracing. I get a call about an hour later from the cardiologist reviewing the EKG, calmly thanking me for sending him in because the wiring in his heart essentially wasn't working and he could drop dead at any moment, again. Because the week before, he hadn't passed out, he died. Through some lucky miracle his heart started again. He's got a pacemaker now and he and his wife are doing just great. Casually dies. Paramedic here. So many but two come to mind. Responded to a well-being check, basically check on someone no one has heard from in a while. Get there and police advise the woman is dead and appeared to be so for a while, middle of summer. Can smell her before getting close to house, put on protective gear and air packs to move the body. She is rotting, maggots and flies, can see organs. We go to carefully move her into body bag and she opens her eyes and gasps. She was alive and rotting alive. We got her to the hospital alive and she lived for several days more. Second was a suicide, shotgun to the face. He held it under chin but it slipped and he blew off front of face except one eye. He was awake and tried to talk but obviously couldn't. We ended up sedating and intubating but he lived and walked out of hospital after tons of reconstructive surgery. How was she rotting, and not dead? Not a doctor but I work in cardiology, and my doctors all do rotations at our hospital. Our hospital is a level 5 trauma and it's the closest hospital to a lot of rural area, so a lot of traumas that happen way out in the middle of nowhere end up at that hospital. This guy came in having been in a car accident. He was covered in road rash and his chest was more or less torn open. Apparently, as we all later learned, he'd been drinking and riding passenger in his friend's car. He wanted out of the car, his friend said no, so this guy, once again, very drunk, decided to try and jump out of the car window. He somewhat succeeded, but his shirt caught on the side view mirror and he got dragged until the driver stopped flipping out enough to come to his senses and stop.